Hello and welcome to Yerba. My name is Dr. Bill Gradishar. I'm a professor of medicine at Northwestern University where I focus entirely on breast cancer. And today we're going to be talking about vaccine development for triple-negative breast cancer. And as a starting point, just to level set everybody, there are no vaccines approved for breast cancer, period. But this has been an area of intense research for the last 3 to 4 decades, hoping that one can develop a vaccine that would either prevent breast cancer from developing, or in those patients who have had breast cancer, can prevent it from recurring. There was a recent publication highlighting some work that is being done focusing on the development of a vaccine for triple-negative breast cancer. And before we get into that, let me just give you a little bit of background regarding triple-negative breast cancer. And triple-negative breast cancer is really the absence of certain things. And that is when we typically diagnose somebody with newly diagnosed breast cancer, we identify whether or not they have the estrogen or progesterone receptor. And if they're present, we consider these endocrine-sensitive tumors. If HER2 is present, we think of that as a HER2-positive breast cancer. And the absence of all three of those markers really leads to what we call triple-negative breast cancer, the absence of ER, PR, and HER2. So it's really the absence of certain markers that results in the classification of calling something triple-negative. Triple-negative breast cancer is an aggressive subtype of breast cancer. It presents in the full spectrum from early stage disease where patients undergo surgery with curative intent to patients presenting with metastatic disease, as well as patients who once had early stage breast cancer but then subsequently develop recurrence of their disease and now have metastatic disease. There have been a lot of different approaches used to treat triple-negative breast cancer. We think of this still for early stage breast cancer patients as potentially curable. And one of the major advances that has been made in taking care of patients with early stage breast cancer is the combination of chemotherapy with what we refer to as immunotherapy. And immunotherapy basically allows the immune system to attack tumor cells if present. Tumor cells have an ability, in a sense, to mask the tumor to the immune system. And by using immunotherapy, you're really unmasking the immune system so that the tumor is able to be seen by the immune system. And in combination with chemotherapy, this approach in early stage breast cancer has proven to be very effective. We use preoperative chemotherapy with immunotherapy, and that has been shown to decrease the chances that the disease will recur at a later date. And it's also shown that the number of patients who go into surgery have a higher probability of having no disease present in the breast at the time of surgery. So immunotherapy in the preoperative setting for triple-negative breast cancer has been a major advance. In patients with advanced disease, so patients that have metastatic disease, we look for certain markers that may be present that would indicate whether or not a patient is a candidate for immune therapy. We sometimes refer to this as PD-L1. And if this marker is present and at a certain level, then we consider combining chemotherapy with immune therapy, so-called checkpoint inhibitors like pembrolizumab. And that has also been shown to be more effective than chemotherapy alone, though it is not curative. So the use of immunotherapy to really take advantage of the body's own immune system has been something that has been the focus of research and actually now in standard routine clinical care for the last several years. So what vaccine therapy essentially is the idea of, again, utilizing your own immune system to recognize certain aspects of a tumor cell, an antigen that may be present, and then revving up the immune system if it identifies that marker floating around in your body. So you could imagine that that would be useful for patients with triple negative disease if there was a particular marker that is present. And I should also say, as a side note, these vaccines have been tried and are being investigated for HER2-positive breast cancer, for hormone-sensitive breast cancer. So vaccines really provide information for your immune system to be aware of certain proteins that are floating around that are distinct to tumor cells. So, depending on the subtype of breast cancer that may be present, there may be certain proteins that are identified with that kind of breast cancer. And in triple negative breast cancer, there have been several of these proteins that have been explored as a way of developing a vaccine and basically providing memory for your immune system. So if it saw that there was a protein floating around in your system, it would be stimulated to attack that protein, and that protein, of course, being associated with the tumor cell. In patients with minimal disease that's not apparent on a scan, but puts them at risk for the disease showing up in the future, so microscopic disease, no scan, no blood test is going to detect tumor cells. But if the immune system detected that protein floating around, it would activate the immune system, and the idea is that that would result in the eradication of microscopic disease that could be present. And that's the whole rationale behind vaccine development. The settings where vaccine development is being explored are in patients who have undergone curative intent surgery and perhaps chemotherapy, and they're free of disease as best we can tell. But because we have a concern that the disease is aggressive, microscopic disease could still put the patient at risk for a disease recurrence. The drug development or vaccine development that has recently gotten some press is a trial that's being conducted at the Cleveland Clinic as well as other centers, looking at vaccines that are being developed for triple negative breast cancer in patients who've already undergone curative therapy. And the target in this case is a protein called alpha-lactalbumin. And this is a protein that is present in breastfeeding women, but otherwise is not necessarily present except in patients with triple negative breast cancer, where that protein may be expressed in 60 to 70% of patients. So again, if there are really low levels of this floating around, it may stimulate the immune system if you've been exposed to a vaccine where the vaccine provides memory to your immune system so that if it sees or detects this protein in your system, the immune system would be revved up to eradicate the cells that express it. And of course, the ultimate goal is to decrease the chances that any patient with this disease would develop disease recurrence. And at the present time, what the data has shown, or the trial has shown, is what many of the other trials over the decades have shown, is that when you administer a vaccine, you can see evidence that it is stimulating the immune system. And there are certain blood tests that can be done that show the immune system is revved up in response to the vaccine that had been administered. And so far we know that from the patients that have received the vaccine, it appears to be well tolerated. The missing piece, of course, is does it do anything? And from that point of view, I'm talking about clinically. Do we know that by getting a vaccine that you're decreasing the risk of the disease showing up again, or are you improving survival? And we do not know that at this point, but the preliminary steps showing safety, showing that there is an immune response, that you're seeing some of the elements of the immune response, including T cells that are important for fighting cancer, are those activated? We can see evidence that the immune system is responding to the vaccine. But the next step, the critical link, is showing that by stimulating the immune system, you somehow impact on patient outcome. And that'll require bigger trials, long-term follow-up, etc. So that is a trial that is being done in patients with early stage disease who receive curative intent therapy. There are also strategies looking at the possibility of identifying women who are at risk of developing certain kinds of breast cancer and then administering a vaccine. For instance, women who have a BRCA mutation who are at a heightened risk of developing breast cancer because of that germline abnormality, that mutation that's present. Could you administer a vaccine and hopefully prevent the high risk that these patients will develop breast cancer at some point in their life? So these are all strategies that are being looked at. At present, we don't have a vaccine that we would recommend to patients. If you are eligible for a clinical trial, of course, we would encourage you to participate, because the only way we can get from sort of preliminary data to have an effective therapy, and in this case we're talking about vaccines, is to enroll patients on clinical trials. If you'd like more information about your specific situation or the options that you may have available for the treatment of your particular case, feel free to go to yerba.com for more information that may be directly relevant to you personally.